Alright, quick question. What if the dental crown you trust to protect your tooth is actually setting you up for bigger problems later? Sounds traumatic, right? But stay with me. Today we're opening a door most people never even realize exists. And yes, I'm here with Dr. Esma, who sees this every single week in her clinic. Dr. Esma, why does this topic make patients' jaws literally drop?
Because, Rasim, most people think a crown is a final solution. Something permanent and harmless. But the truth is, the decision you make before, during, and even after a crown can quietly decide the future of that tooth.
So you're saying it's not just about getting a crown, it's about how and why you get it.
Exactly. And what dentists don't always explain is where things can go wrong, slowly and silently.
That's the scary part, because if you don't know what to look for, you don't even know what questions to ask. Stay with us, because in the next minutes, you'll never look at dental crowns the same way again. Let's make this real. You go to the dentist with a cracked tooth. No pain, just a little sensitivity. 2 visits later, boom, you walk out with a crown and the relief feels instant. Problem solved, right? Did.
That's the exact moment, Rasim, where many patients stop paying attention. Under that crown, the tooth might still be stressed, weakened, or even inflamed. But you feel fine, so no one asks further questions.
And life goes on. Chewing, coffee, late night snacks, zero warning signs.
Until one day, months or years later, that crowned tooth suddenly hurts. Or worse, it breaks. Patients tell me, I thought crowns were supposed to protect teeth.
That's the scary pattern. No drama, no alarms, just quiet damage building underneath something that looks perfect from the outside. This is where people ask Dr. Esma, why does this even matter if the crown looks fine and works fine today?
Because, Rasim, dentistry is about timing. I've seen teeth that could have been saved with a small adjustment or early follow-up. Instead, they came back years later needing much more complex solutions, all because the warning signs were hidden under a crown.
So the crown isn't the villain, the silence is.
Exactly. When patients understand what's happening beneath the surface, they make smarter decisions. They ask better questions. They protect their teeth long-term.
And that changes everything, because once you know what to watch for, a crown stops being a mystery and starts being a tool you actually control. Let me throw a quick real-world moment at you. Dr. Esma, you once mentioned a patient who walked in smiling, zero pain, totally confident about their crown.
Yes, Rasim. Routine checkup. Nothing dramatic. But the x-ray told a very different story. Under the crown, the tooth had been slowly weakening. No symptoms, no warnings, just quiet progression.
And this isn't rare, right?
Not at all. A significant number of crown-related complications I see come from delayed follow-ups, not bad intentions. Patients assume silence means safety.
That's wild, because from the outside, everything looks perfect.
Exactly. That's why understanding the background matters. Crowns don't fail loudly. They fail quietly.
Alright, Dr. Esma, let's put the lab coat on for a second. From a science point of view, what actually changes in a tooth once a crown goes on?
Great question, Rasim. When we prepare a tooth for a crown, we remove structure. That tooth is no longer the same biologically. Blood supply, nerve response, and stress distribution all change. If the bite is even slightly off, microscopic stress builds every single day.
So even if it feels normal, the tooth could be under constant pressure.
Exactly. Studies and clinical experience show that many crown failures are mechanical, not sudden accidents. Tiny forces repeated thousands of times eventually win.
That explains why problems don't show up right away.
Yes, dentistry respects physics and biology. Ignore either one, and time does the damage for you.
Alright, Dr. Esma, let's turn anxiety into action. If someone already has a crown or is about to get one, what's the smart step-by-step playbook?
Step 1, Rasim. Ask for a clear explanation before the crown goes on. Why is it needed, and what's the condition of the tooth underneath? Step 2, make sure your bite is checked carefully, not rushed. Small adjustments matter more than people realize.
And after the crown is placed?
That's step 3, schedule follow-ups, even if nothing hurts. X-rays and bite checks catch silent issues early. Step 4, listen to subtle signals, pressure, tightness, sensitivity, and report them.
So it's not complicated, it's intentional.
Exactly. Crowns work best when patients stay involved, not passive.
Before we wrap this up, Dr. Esma, let's hit the red flags. What should people absolutely not ignore once they have a crown?
First, Rasim, never ignore pressure that feels different from your other teeth. Second, don't assume sensitivity is normal just because the crown is new. And third, don't wait months hoping discomfort will disappear on its own.
So the biggest mistake is silence.
Exactly. On the do side, report changes early, keep routine checkups, and protect crowns from excessive force like grinding or chewing ice.
That's practical and simple, which makes it powerful.
Crowns reward attention. Neglect is what turns small issues into big ones.